Semi-retired. I'm still doing some consulting work. My background is nursing. I've been a nurse for virtually my entire life, and that's how I've been identified as a nurse. My life has evolved around my nursing career, and so that's how everybody knows me. Well, Elaine's the nurse. So my whole family has always, well, ask Elaine if you have a bump or a bruise or whatever. But I've come to the end of my nursing career and settled here in Sooke to be with family. My daughter moved here several years ago, and while we were still living on the mainland, traveled back and forth, and Sooke was always seemed to be really comfortable. Now, I come from a small town. I was born and raised in Drumheller, Alberta, Badlands, and couldn't wait to escape. Moved to the big city, established my career. But coming to Sooke to visit family, I realized that there is an appeal in a small town that has a comfort. And particularly as you become older, that comfort is an essential element of your life.
So I'm going to ask you, first of all, when it was that you did move to Sooke, and how you came to be here.
Oh, almost 5 years ago. And for the first 2.5, almost 3 years, I commuted back and forth. My husband was here, and I commuted back and forth to the mainland for my work. And the weekends always felt I can breathe. And then Monday morning, when I got back onto the BC ferry to head back to the mainland, it was, okay, gather myself. And then when Thursday night rolled around and I was getting back on the ferry to come back here for the weekend, I could relax. And so I realized over time that Sooke was becoming my comfort zone. Now, I'm not a big outdoorsy person. I'm really comfortable with my own company. But coming to Sooke, my daughter was here, my grandkids were here. It felt relief to be here. That being said, getting conversations with new friends, there were things about the community that I thought, well, maybe I could be a contributor. But at the time, initially, because of my work commitments, I didn't have the opportunity to be able to do that. But now work commitments are significantly less, and my commitment is now to my community. And when the by-election came up, it seemed that it was an opportunity to participate, to give something back to the community. And essentially that's what I've always done in my career. Nursing is a unique profession, but healthcare itself, I've always felt it was necessary not to just take, but to give back. So I spent 12 years on the board of directors of BC Care Providers, which is the organization that's responsible for long-term care, assisted living, independent living in this province. So I was on the board of directors with BC Care Providers, and that was my way of giving back to my profession, to my chosen career.
So I want to go into a little bit here, back before it became your career, to ask you where it all came from, that feeling of needing to give back and so on. Where you spent your childhood in Drumheller, what kind of childhood was it?
Oh, it was regular kids. I mean, Drumheller is sort of desert-like and dinosaur bones and swimming in the summer. And I was kind of a geeky student. And initially, I was going to be a physician. I mean, from grade 4, I think. That was when I made the decision that I was going to be a doctor. Well, that kind of didn't work, but nursing was the next best option, and I'm glad I did.
Was there something that happened when you were young that made you think you wanted to be a doctor, or where did that come from?
I don't know. I really don't. I just
Knew.
I just knew. I just really knew. And, skinned knees with my kid sisters. It was always, okay, I'll put a Band-Aid on it. And it was almost, I don't know how to explain it. It was almost just natural, and it felt comfortable and right and whatnot. So
You, it's interesting because you mentioned putting a bandage on your kid's sister and so on. Were you the kid who was just really responsible when you were young?
probably, I was the oldest and I had two younger sisters, but I guess the firstborn always, the responsible one. My middle sister is the peacemaker, and my youngest sister was always a little bit of the rebel. So yeah, it was always got up early in the morning to study, studied really hard, did well in school, but I was kind of bit of a geek. Yeah,
Did you like studying? Did
I
you
loved
like
it.
school?
I loved it. I loved it. Yeah, yeah. My grade one teacher set me on the right path. Uh, I remember that lady to this day. She and I shared a birthday, but yeah, she set me on the path of learning, and I've been a lifelong learner.
Usually people like that are readers. Were you a
I
kid with a
am
nose in a book?
absolutely, absolutely. I went through every book in the kids section of the library in Drumheller, and then graduated to the adult section of the library. And I probably do a book every 2, maybe 3 days,
Okay, so
unless it's a J.K. Rowling's book, because they're like enormous, so they take a little longer. But yeah, I still every day I read.
so when you were a kid, who were your favorite authors, favorite characters, favorite stories?
Nancy Drew, Hardy Boys. Yeah, and then as I matured, I moved into science fiction, and then as an adult, I really enjoyed Patricia Cornwall, Diana Gabaldon. So the Outlander books were, when they first came out. So yeah,
It's interesting. When I was a kid, I was a reader. I had my nose in a book all the time. And of course, as you mentioned, you go through the library and you keep going up. And I found myself at one point definitely reading beyond my ability to truly understand what I was reading. Did you ever find yourself at that point?
the first time I read Dune and The Lord of the Rings, those I had to go back and reread probably 5 or 6 or 10 years later to try and make sense of them.
Yeah.
But yeah.
Yeah, some of mine was Anna Karenina.
Oh yeah. Well, no, some of the classics I avoided, other than first year English university, where you had to read some of them. But
So the doctor thing, was that partially a love of science?
I wasn't great at science, chemistry, and I took, obviously chemistry and physics, but I actually didn't take biology.
And you
Strangely
became a
enough,
nurse.
I did. I did. I was able to get into nursing school without biology because of some of the other courses that I had taken, which is kind of funny.
So when was it you events happened and you couldn't become a doctor, so you decided to nurse instead? Was that because it was sort of a substitute for being a doctor, or were there attractions to being a nurse that you had?
I had a health issue that put me in and out of hospital for off and on for a year and a half, 2 years. And I was able to see the difference between the caring of the bed at the bedside and the snobbiness of some of the physicians. And I mean, back in the 70s, there was definitely a distinct difference in the hierarchy of nursing and physicians, and I gravitated towards the work of the nurses because it seemed to me that they were more easily involved in actually looking after a person, whereas the doctor was more interested in looking after the disease.
I was about to say, there's a difference in looking for a solution to the disease and in providing a better life of living for the patient.
Exactly. A holistic approach to, you're still seeking, you're looking for problems, but creating the solution, coming up with the plan to get somebody better may not necessarily be part of the diagnostic process. It's part of the human process. And so that's really been the appeal of my nursing career. And initially, I started working in labor delivery, ICU, emerge, nursing supervisor, and then the latter part of my career was long-term care. So I've run the entire span of life from infancy to old age. And there's a reward in assuring that somebody at the end of their life is comfortable at the end of their life. Now, that may sound a little bit platitudinous, but that's sort of what drives me, what directs my care.
So, as you worked with people who were towards the end of their life, what did that do in terms of shaping your own perspectives on what you thought your life should be?
I think what we wanted was for people to live their best life, to get, when you're dealing with somebody with Alzheimer's disease, that doesn't necessarily mean that they cannot have a comfortable, satisfactory day. You know, their day can be just as happy as if they didn't have dementia. And that's part of the responsibility of the caregiver. And so the team that I was able to fortunately put together lives that every day. And so as I've stepped away and now watch the kids that I trained do what they need to do to make the lives better of the people they're caring for, that's a sense of pride that I have, that I've been able to contribute to their learning. So again, that's part of what drives me, is to make things better. Which sounds kind of...
No, it doesn't. It doesn't at all. So one of the things about seniors that I found really revelatory during COVID was that there was a real kind of duality in terms of the approach. There was horror at what happened in some seniors' homes. Mm-hmm. But there was also a little bit of a sense out there, well, if somebody's got to be sacrificed, we've got to save the young and healthy. And I found that a little bit interesting and very disturbing. How did COVID shape, what you were thinking about seniors' needs?
The unfortunate thing with COVID is my care home, one of my care homes at the time, and I was looking after 4. One of them was one of the first care homes in BC that had an outbreak. And what had happened is one of our residents had gone to visit the dentist. Now, this was subsequent to the dental conference and where COVID spread through the dental community pretty badly. So he was our number one. My care home had 90 residents. But of the 90 residents, we had 8 who became infected with COVID. The gentleman who had gone to the dentist was the only fatality that we had of during the outbreak. And God forbid, we had no idea at the time because it was so early, and all we were hearing were the horror stories coming out of Ontario and Quebec. So we had no idea what to expect. We slapped infection control practices that we had been using for influenza from past years. And I was so proud I had not one single solitary staff member who became ill. Not one. There were several that didn't come to work because they were afraid, because again, we didn't know what was going on. But I had one carried that I said to her, "Thank you for being here." And she said, "I couldn't not be here." And I lost it when she said that to me, and I thought, okay, these are the people that need to be working in long-term care. And we weathered the storm. We lost one person. We had 4 of the 8 that had no symptoms. And the only reason we knew that they had it was because we had done some swabs. Not a single staff member, and we limited it to 8. And so I was pretty proud of my crew.
It's a lot to be proud of, especially in those early days when there was so much, nobody knew what was going on. Afterwards, when things settled down from COVID, what were your thoughts on what needs to be done to protect seniors, particularly because they were so vulnerable in that experience?
Well, the one thing we learned was that it's really important for families to still connect. I think the mistake that we made was keeping families away from our elders because they were confused. We were all wearing masks, we were all wearing gowns, they couldn't see our faces, they couldn't hear what we were saying. And we also kept their families away. And yeah, iPads, FaceTime, but it's not the same. Sometimes you just need a hug. And, that was missing for a period of time. And I think we've taken a more pragmatic approach subsequent to the first outbreak. And we've opened things up. People are more responsible. But it was really, really, really hard on the staff.
The compassion that staff showed in that time was truly mind-boggling.
It really was. It really was. And as I said, when my staff member said to me that I couldn't not be here, given what we were seeing happening, as I said, in Quebec and Ontario, the deaths that were happening amongst the staff, I felt really proud that the staff that we did have were so committed. And that she still works with my care team, yeah.
So you're telling me it's people as much as policy that makes the world go round.
Oh, absolutely. Absolutely. I mean, you can't function without policy and rules, and sometimes regulations get in the way of it's a discomfort sometimes. The regulations make things uncomfortable, and sometimes you have to bend the rules a little bit or push things a little bit to get the rules changed enough that you put the humanity back. And I think one of the most brilliant things that's happened in long-term care, Alzheimer's care, is the village in
Europe, isn't it?
in Europe, yeah, in Amsterdam, and I was really fortunate to be able to tour that village in Hugweit and see how normal life can be for people with dementia. We're pushing up against the regulations here, but I know in Comox they're building a village. I know there's a village in Langley where they have pushed the boundaries, respecting the regulations for the most part, but pushing the boundaries so that we can normalize aging.
And these villages, we should explain, are made so that people don't get lost, so that everybody who's in a little shop knows exactly how to manage somebody who comes in with Alzheimer's. Exactly. So the whole village is oriented to the fact that somebody's wandering around and maybe not exactly clear on where they are, but they're treated with humanity and respect at every step. Yeah.
Exactly. And they can go to the physio, they can go to the hairdresser, they can go to the pub.
It's a life. And that leads me into asking you about, because this word means a lot of different things to a lot of people. What does community mean to you?
Community is, that's a really hard way to describe it. It's an ability to interact with everybody comfortably, to feel safe, to feel secure, to know that there are people who care about you, who, if you have difficulty, if you run into trouble, somebody is going to step in and say, what can I do? In the UK, there are places, business places, hotels and whatnot, that have a butterfly on the window as you enter that indicates that they're a senior-friendly, Alzheimer-friendly establishment. So there's a recognition that sometimes somebody might be coming in that's a little confused, and there's respect attached to the butterfly on the window.
That's a really good example of what businesses can do. And I'm not limiting you to talking about municipal politics here at all, but what is the role of government in fostering community?
Oh, well, obviously healthcare, and I mean we're dealing with that, and that's a topic for a lengthier discussion than we've got here. A place where an elder can walk, a sidewalk. Municipal governments can ensure that there are sidewalks. Municipal governments can ensure that there are elder taxis, that there are that the taxi service has wheelchair capability so that Mrs. Jones can get from point A to the doctor's office or whatever. Those are, hand out the taxi license to encourage the taxi companies to do that. But sidewalks, and a walkable community. I think one of the difficulties that we're seeing with the big cities in particular is that they moved away from municipal responsibilities, civic responsibilities, into the huge social responsibility. It's potholes and sidewalks. I know that sounds pretty simplistic, but if you can't walk in your community, how do you enjoy your community? Because we're such a car dependent society now. And of course, Sooke Road is our nemesis. And I mean, that again is a topic for another day when they get the official community plan finally done and we can move on proper transportation. But even I look back to my hometown. They have a community seniors bus that for $2, I mean, this is 5 years ago, for $2 a senior could take the community senior bus, because it was only for seniors, to go from the assisted living site to Walmart or to the doctor's office. And it was only in town. So that's something that the municipality or the community could do to ensure that our older population is mobile, because many of them have lost their driver's license. So
So we're in Sooke, a place where people still talk about old Sooke and new Sooke, and you're new Sooke,
I
and
am.
so you are part of the development people talk about. So how do you look at what that development should be for Sooke going forward?
Well, again, I harken back to what I said about the official community plan, and in the absence of that, it's the development is pretty fragmented. Any development that happens now has to be well thought out, well planned, respectful of the environment of the land, because we are limited by the topography. But the infrastructure has to be built in. The schools have to be built in. And God forbid, let's please get a community health center. We're a population of over 15,000 now. And most of us don't have a family doctor here.
And I'm asking this of all the candidates. Events south of the border have meant that economic policy out of the border is at best uncertain. And uncertain economic policy means uncertainty around the world. We're going through a time of changing alliances and all of that sort of thing. There's a pretty good chance we're going to feel some economic hurt in some way. What do you think Sooke should be doing and looking at if that comes to town?
Well, I think we have to look at procurement practices. The majority of the fiscal responsibility falls on the senior levels of government. The practices from the federal government, provincial government, more or less dictate what we can do at the municipal level. But we can still look locally to ensure our purchases are as much as possible Canadian. My groceries now And I was absolutely thrilled yesterday when I went to the grocery store. I actually found romaine lettuce from British Columbia. And I thought I'd won the lottery because that's been my one area of concern, because all my romaine lettuce has come from Taylor in California. So this was BC and BC strawberries. So, yeah, shopping local and keeping purchases at the municipal level as local as we possibly can. We don't have a lot of industry here. And I don't know that there is any opportunity for bringing industry back. So we're limited in terms of what kind of retail can come in, what kind of restaurants, whatever. But again, reasonable, practical retail, so that it would support our kids, so that they're not leaving and we're not dependent on Highway 14 to go to Langford to work or Victoria to work. So
I'm going to ask one other question, which has got nothing to do with anything we've spoken about, and it's what kind of music do you listen to?
80s rock.
Why are you grimacing?
I don't know. It ages me, I guess.
Okay, so do you have a favorite artist?
Bon Jovi. It was the hair.
Well, he's aged well, too.
He has. Indeed. Yeah, and he's still got hair. It's just not as long as it used to be. And, of course, Bruce Springsteen, the Beatles. And I was never a huge fan of the Rolling Stones, but my husband was. My husband's also a big fan of Led Zeppelin, so when I'm in the car with him, we listen to Led Zeppelin. And my grandkids, right from the time they were really little, the Sunshine Song by the Beatles and anything by Led Zeppelin. So they would get in the car with Papa, and that's what would go on the radio.
This has been a delight. Thank you so much for taking the time to talk with me today.
My pleasure. Thanks.